Now that's what I'm talking about.
This is called trichotillomania. It's an excessive hair pulling disorder that unfortunately impacts more people than you would think. This condition commonly goes misdiagnosed by healthcare providers, but it impacts people mentally and emotionally, and it can lead to balding. Together we're going to explore what trichotillomania is and what the treatment options are that exist. Let's first define the word trichotillomania that was derived from Greeks. Tricho means hair, telio means pull, mania means obsessive. This is an obsessive compulsive disorder to want to pull hair from your scalp, your eyebrows, your eyelashes, or even your body. And this is a condition that unfortunately starts in your adolescence and can last through the course of your entire life. Women are more impacted than men. It's unclear why. But the thing that's really critically important to understand is that there's a belief that this is a mental health condition. Under the classification of DSM-5, there's an association with anxiety, depression, and OCD. Clearly, if someone wants to pull their hair, there's some mental health aspect at play. And so as a hair transplant surgeon, I have to be very cognizant of this as a potential cause for someone's hair loss. And sometimes a therapist needs to be involved in helping to coach patients to get through this condition incrementally. In order to understand whether you have trichotillomania, I'm going to read off the DSM-5 criteria for this hair pulling disorder. Number 1, recurrent hair pulling leading to noticeable hair loss. Number 2, repeated attempts to reduce or stop the behavior. Number 3, significant distress or impairment in daily functioning due to hair pulling. Number 4, hair pulling is not caused by a medical condition like alopecia. Number 5, the behavior is not explained by another mental health condition. If any of these points resonate with you, you might have this mental health condition known as trichotillomania.
I got a question. Anybody have trichotillomania and have they ever stopped? I've been pulling out my eyebrows for 10 years, I think, and I've been trying to find ways to stop since then, but the reasons on the internet will always be like, try to give the hair a name and a story so you feel emotionally attached. And clearly that doesn't work. Ooh, if you think this one's bad, you don't want to see the one I'm covering. But truly, has anybody ever stopped? Anybody have this and anybody ever stop, like fully, for a long time?
This clearly demonstrates the psychological challenge of living with trichotillomania. Here's someone who's had this condition for over 10 years. She's aware of the mental health component of the disease, but she's also aware of the fact that she's losing hair. That's why she's covering her eyebrow. When you pull out your hair, okay, you're causing scarring to the area, whether it's on your scalp, your eyebrows, your eyelashes, and the hair follicles can't regrow. So a lot of these people who live with trichotillomania also have hair loss, and it can be embarrassing, and it can be upsetting, it could be depressing, and so it's challenging. This condition is really, really challenging to live with. Now, sometimes people pull hair out because they're stressed, okay, and that sensation of pulling the hair out feels great, and sometimes they do it because it's subconscious. When they're driving in the car, reading a book, watching a movie, they're just pulling out their hair for that kind of immediate sensation, that good sensation of pulling out the hair. But the long-term side effects are that you could develop hair loss. Now, some people who have this hair pulling disorder actually swallow their hair, and that's called trichophagia. And it's very, very dangerous to do that because you can cause obstruction in your bowel and form a hair plug, a ball of hair, which would be called trichobezoar. Do not pull your hair out and swallow it, because that can cause a lot more complications. And as it is, if you're pulling out your hair, you're already causing hair loss on your scalp. It's worth pointing out that if you're someone who likes to pick your skin, which is called dermatillomania, or nail biting onchophagia, you might also be at risk for hair pulling. So keep that in mind. Now it's time to talk about treatment options. And commonly, the patients that I see come into my office after they've pulled out a significant amount of hair and they want to replace it. And remember, once you pull this hair out, it's gone. So really the only replacement is with a hair transplant. But the problem is a hair transplant is not the first thing that needs to be addressed. The first thing that needs to be addressed is the mental health component of this disorder. So a therapist should be involved. Commonly, if you have this condition, trichotillomania, you need to go through cognitive behavioral therapy to address the root cause for why you're pulling your hair out to start. It's usually associated with anxiety and stress, as we discussed earlier, but these therapists can help you build new habits to prevent you from wanting to pull out your hair. For a patient who seeks out a psychiatrist to address this condition, they commonly are placed on either an antipsychotic, an antidepressant, or an SSRI. And these medications are instrumental and they're very helpful to help someone address the anxiety and the compulsion to pull out your hair. Some practical steps that you can start doing today, if you can't seek out a therapist, is you can try to use a stress ball or a fidgeting tool. You can practice mindfulness, yoga, anything that's going to lower your anxiety and stress, and journaling. Talking about and writing down why you have this urge to pull out your hair are all beneficial to help reduce the likelihood that you're going to start pulling. If you're someone who's experienced significant hair loss from this condition and you want to start camouflaging your hair today, here are a few steps that you can take. First and foremost, you can use a hat, a scarf, you can use hair extensions. Wigs are also an option. If you've lost hair on your eyebrows, you can use a pencil or makeup. And then ultimately, if you really want to address the long-term issues of the hair loss, first, you have to make sure that the mental health component is addressed, and then I would feel comfortable with you exploring a hair transplant, because we want to make sure that you don't pull those hairs out that get transplanted in. If you're struggling with trichotillomania, remember, you are not alone. There are millions of people that are impacted by this hair pulling disorder, and there is certainly help out there. So, if you haven't already, please hit that subscribe button. And if you have any questions about this hair pulling disorder that I have not addressed, please leave them in the comments below. And as always, I'm here on your journey to address your hair loss.